Yes. Great. Now I have to fix TikTok. Yo, nkulunkulu wami. Maya kuningi. Oh, kuningi. Kuningi and one shame. Yo. Hayi ngeke. Guys, it's a lot. Hi everybody. Hi TikTok. Sorry guys, I was fixing my screen. It was still stuck at panel receiving guests, and today's live is not receiving guests. So yeah. Alright. Oh, Facebook's so chilly. Guys, just understand it's a lot. I'm doing this thing. It's a one-man show, and yeah. So hi everybody, we are back again to our You Got This Dearest Mommy weekly sessions. We are live every Friday 1 p.m. South African Standard Time, and we are live on 3 platforms simultaneously. We are live on Instagram, we are live on TikTok, and we are live on Facebook. Welcome one, welcome all. Please do share the session so that anybody who needs it for real can see it and learn, because it's an educational session. Please tap the screen, TikTok or wherever. Where I was not live on Instagram. See, that's what I mean. It's a one-man show. Right now I'm worried that it's thundering outside and electricity may just ditch us any second from now, and I don't have any backup power, so it's just electricity. I'm counting on electricity for my connection. Hi Instagram. So yeah, we are on week 6 today. We're on week 6. Oh my, imagine I didn't even introduce myself. I'm Beacon of Light, the luminary of holistic empowerment. I'm a mother of 2. I'm a full-time mom. I have gone through natural birth and C-section birth, so I have experienced both types of births. Hence today we are on week 6 talking about preparing for birth, plans and preferences. That's what we're going to talk about today, and I'm more than qualified to address this issue because I am a mom, 2-time mom, both birthing methods, right? So I'll just be quick because yeah, electricity may ditch us any moment. It's thundering for real. Okay, so yeah, today we're talking about preparing for birth, plans and preferences. What is birth? I will just start with discussing that. Like, what is birth really? Yes, we understand that it's just a high rooted radiance. We understand that it's just a normal occurrence whereby a woman is bringing forth a life into the physical, but it's more than that. Let's talk about it biologically. What is, in biological point of view, what is birth, right? Here it's a cascade of hormones, right? Your oxytocin, your endorphins, your prostaglandins that orchestrate contraction, pain, relief and bonding. So it's just a concoction of these hormones, each playing their role. Oxytocin to minimize pain, to maximize bonding, endorphins to make sure that the contractions happen, the baby comes through smoothly, right? So these hormones work hand in hand to bring forth the baby, to make sure that mother and child are communicating adequately, because if there is no communication between mother and child, the baby will not know that, okay, I have to go through this canal. Maybe the baby can come out through the mouth. Right, so this communication is important so that the baby knows that, okay, let me take this path, come out through this path. Okay, wait, mommy is still breathing. Oh, it's a contraction now. Okay, mommy is ready to push, let me push with her, let me help her, right? So these hormones help mother and child to communicate in the so that the birthing process is efficient and effective, right? That was the biological point of view, and now we move to the quantum point of view. What is birth really in line with quantumness? So in quantum point of view, it is the event of bioelectrical signaling exchanging energy and oxygen from mother to baby. It's almost the same as the biological point of view. However, this one is taking it in the electronistical, energetical point of view, right? That it's when the energy is between mother and baby. Hi Diana, thank you Diana. Right, it's when the connection between mother and baby, electromagnetic frequency, they communicate to understand what is happening. What are we going to do now? Oh, okay, we're pushing now. Oh, okay, we're posing now. Oh, okay, we're breathing now. Right, in the quantum point of view. And then in the cultural point of view, what is birth? Culturally, birth is a communal ritual where a new life is welcomed into society, right? It is not just a mother bringing forth a life just like that. No, it's a ritual. Preparations are put in place, standards are put in place, traditions are carried out. There are things that are done in line with birth. It's not just pushing and welcoming a child. No, it's not that easy. It's deep. It's really deep. Okay, so since today we're talking about preparing for birth, and we are specifically talking about the plans and preferences in line with birth, let us talk why birth plans matter. Right? Why should I plan for birth? It's a natural occurrence. Everybody has done it. I'm not the first one to ever give birth, so it means it's just a natural thing. I should just go with the flow, or just wing it, right? I'm saying no, don't just wing it. Let's discuss as to why planning for birth is important. First of all, it aids clarity. Clarity how? A written plan and an executed plan, a planned plan with execution, written, memorized, shared with other people, whatever. That plan is easy to communicate and to translate to healthcare workers. That's number one, clarity. And then number two, why is it important? For agency, right? Planning and having this plan executed, written or shared, it shifts mom from being a passive patient to being an active participant in the birth, right? Somebody may say that, they'll just take care of me, right? As I've said, that I'm not the first person to give birth, and I'm not the first person to be ever helped in line with birth. So please, I'll just surrender myself to whatever, like, come what may. It's okay. It's perfect. However, what I'm talking about right now, the sense of agency. Whenever you're just surrendering to the process, which is good, but then that surrender then makes you a passive patient. You're just there to go with the flow. I'm not saying it's wrong. I'm just saying that it may lead to some sort of a stress, lack of control, lack of participating, right? Yet when you participate, you know that, oh, when this happens, I can do this, right? You are ready for whatever, right? Yes, come what may, but if this happens, I have a contingency plan, or I have something planned out for, right? So yes, it helps you shift from being a passive patient to being an active participant. The third one is resonance, right? When you have a plan, you understand this plan, and you are able to share it clearly with the healthcare providers or anybody else for that matter. That helps in being heard and understood. Whereas if you haven't planned for this thing, you may go there and be like, oh, I want this, I don't know how, right? You're having second thoughts, you're second guessing yourself, you're not clear enough. So they may say, please, you're wasting our time, right? Yet when you know, when you go in there and there's resonance, you state whatever you need, why, how, and all of those nitty-gritties. It may be easier for you to be understood and heard, and then the whole thing will just flow. Resonance, baby, resonance, right? So all these things lead to reduced cortisol, which is the stress hormone, right? You are less stressed. If you have put your birthing plan in place, there'll be clarity, agency, and resonance. And with these three things, the stress hormone is minimized, meaning that your pregnancy will be smooth, your birth will be smooth, because I cannot emphasize this enough. Birth, labor, and delivery is I want the perfect word to use. But then it's impeded, right? Whenever you are stressed, everything gets slow, sluggish, stressful, annoying, and you may have a very, very horrible experience just because your stress hormone was high, right? And then you may look at somebody else, they're quick, everything was just flowing and all of that, just because they were not stressed, they were not under a lot of stress, right? So we don't want cortisol to rise during this period. Well, it's okay for it to be there, but not above the recommended level. Okay, so elements of a birth plan. What do we need in a birth plan? Also, I have a PDF version in place. If you're interested, don't be afraid to check out my stories. Every day I post stories on how you can contact me, because also we hold a safe space for moms, whereby we just sit and just vent, just relax, meditate, hear and be heard, right? That's just the safe space. I also have a room whereby that is done. So if you're interested, I post stories every day. Okay, so this PDF is a PDF of my, according to me, what should be in a hospital bag. You may find this, hi Anna, thank you Anna. You may find these things in any PDF, online PDF. But then just know that it won't be according to me. I'm not saying that my according to me-ness is better, but then I'm just saying that my according to me-ness is extremely divine. You will never find it from anywhere else except from me. Right? So exactly, I have a PDF of my according to me, what should be in a hospital bag. Okay, but then let's move on. Elements of a birth plan. Right, what should be in a birth plan? To help you gain clarity, agency, and resonance. What should be there? Number one is the environment, right? Hi, Lindy Wellens, please renew your BIM. Please renew your BIM. I don't want anybody here with a gray BIM on TikTok. Lindy Wellens. Okay. So, number one should be the environment. Like, think, okay, what's the kind of environment that I want to give birth in? Will it be in a hospital, home birth, forest birth, mountain birth, river birth, bed birth, any kind of environment you want? Be clear with that. What kind of environment do I want to give birth in? The type of music, do you want music played, do you want silence, right? Be clear with all of those things. Lighting, bright lighting, I want it to be in a dark environment, under the moon, under the sun, under high lux, whatever. Just be clear of the lighting. Should your partner be present or absent? Do you need your partner there or not? Why, right? And also the doula. Do you want a doula present, or it's going to be just healthcare providers? That's if it's going to be a medical birth in the hospital or clinic. So do you want your doula there? Right. Oh, what is a doula? A doula is somebody that was helping you throughout your pregnancy process and will help you deliver the baby. So if you are going through the medical route in a hospital under healthcare providers, do you want your doula to be there assisting the midwives? Yes or no? Do you want your partner to be there? Yes or no? So just set the environment. Like, how will the environment be? Have those things in place. All right. So number two, pain management. Oh, labor and delivery. It's painful. Ask it from me. I've experienced both C-section and natural birth. And on both cases, I experienced labor. Oh yes, it was an emergency C-section. Story for another day. But then, today let's focus on... Oh, notifications. Today, let's focus on the elements of a birth plan. As I've said, pain management. We are truly romanticizing martyrdom, pain, and struggle, right? In our culture, we believe that birth without pain is not birth at all. I don't believe in that. But then there's this other reason, which makes more sense, and yeah, it's a bit valid, that in our countries, especially the African countries, we really don't have the equipment, the resources, and the skill to monitor a medicated mother, because let's make an example with the epidural, right? The epidural is a numbing drug. When it's administered to the mother, they feel nothing, no labor pains, no nothing, no contractions, which means that when the mother is giving birth, when it's time to push, they may not feel they may not have the perfect timing, they may not feel the contractions, meaning that the baby may be at risk of not being able to come out on time or struggling without mother's help, right? So this thing needs severe and heavy monitoring, highly experienced people, highly experienced people to monitor the situation, which means we need an epidural person in place. There are a lot of people that are needed in place to execute this birth process, right? Helping the mother push on time, monitors, heavy equipment, which we cannot afford, especially in African countries. So to make sure that maternal mortality and neonatal mortality is lower, let's just do it only. Let's do it naturally, bare, right? So the mom should just give birth without any painkillers or pain assistance, right? We're still on elements of a birth plan. We've talked about the environment, what kind of environment you want. We've talked about pain management, natural versus medical, and then interventions. What kind of interventions do you prepare? Which ones do you want? Which ones do you not want? Right, we've got C-section as an intervention, emergency C-section. We've got induction. If there is a problem, do you want your baby to be induced or the labor to be induced? And then there is also episiotomy. Yes, episiotomy, whereby they cut the perineum, the area between the canal and the pupilli, right? They cut it to expand the canal. So be clear if you want those interventions or not, and if not, what interventions do you have in mind, right? Just have it planned out in your mind. So number 4 of the elements of the birth plan, it's immediate post birth. What do you want immediately after birth? Skin to skin contact, right? Skin to skin contact, it helps in bonding the baby with the mother. It helps the baby's temperature to regulate and the blood sugar, and also helps the maternal, it minimizes postpartum depression, right? Maternal emotions, right? So with the skin to skin, would you want it? How would you want it? You don't want it? What do you want in place of skin to skin, right? Delayed cord clamping. Delayed cord clamping helps the baby extract the blood from the placenta effectively, which means that it's maximizing iron uptake, eliminating the risks of anemia in the baby, right? So that's why the cord is delayed to be cut. In ancient traditions, the baby would move around with the placenta for the 7 days until it falls off for itself, right? Sometimes it would be 7 days, sometimes it would be the whole month until the baby comes out to meet society, right? Otherwise the placenta would be taken with the baby, along with the baby, just like the umbilical cord, the thingy, the what is it called? Yeah, the thing that is clamped with the baby moves around with for the first 7 days until it falls off on its own. That's the one. Back in the day, the baby would carry the whole placenta with them for the whole 7 days until it falls off for itself, right? So that they uptake utmost amount of iron, the serum, and every kind of biological need from the placenta into their bloodstream. So they would move around with the placenta. The placenta was not removed from the baby. They would literally move around with the placenta until it falls off for itself. Right? They understood what they were doing. However, in today's day and age, no. Infections, well, that's not where we are. Today I'm a scientist. Right? So decide on what you'd want to be done immediately after birth. And also if you'd want breastfeeding initiation. Some people, breastfeeding is not a skill. I'd forever emphasize this. Motherhood isn't instinctive. It's not an instinct. It doesn't come naturally just because you're a woman. No. But then that's what society believes. Society says that, oh, a woman, that means that, you're supposed to be a mother. You don't need any mentoring. You don't need any initiation. I always say that even walking is not a biological skill. The baby learns from watching the people he or she lives with. If the same baby can be brought up by dogs, the baby can walk on all four. I promise you, the baby can. So this thing is not a skill. Motherhood is not a skill. It doesn't come naturally just because you're a woman. No, you learn it from the people before you. So yes, there is literally initiation in every form of life. Nothing is a biological measure or biological skill. I promise you that. Right? So sometimes you'd need breastfeeding initiation. Would you want that, or would you want to wing it and figure it out for yourself? For me, I figured it out on both instances and it worked. Right. Okay. So the last one is visitors and boundaries. These are still part of the elements of a birth plan. Visitors and boundaries. Who do you want to visit? When do you want them to visit? And how do you want them to visit? Have that in mind so that you're not overwhelmed by a lot of visitors coming to you at the same time, or when you're not ready to receive visitors. So be clear on who you want, when you want them, and how. Right. So these are elements of a birth plan. One, the environment you want, you should be clear about it. The pain management techniques, interventions, immediate post birth, visitors and boundaries. And again, I will always say this and I will always emphasize this: labor, delivery, in fact, the whole motherhood journey. Yes, you may plan. There's a phrase that says, we plan, God laughs. Right? So yes, in this journey, this whole journey called motherhood, you may plan so that you can just have a sense of agency, right? However, you can never be in control of everything, right, guys? Life has ups and downs, lefts and rights. Nothing is constant, right? So you may plan, but when things take a narrow curve or a 360-degree turn, be always ready to cross bridges when you get to them. Be always ready to tackle things whenever they appear. Don't go like, oh no, this wasn't part of my plan, so I'm going to collapse, crumble, and fall. Right? No. Be versatile, be malleable and ductile for every situation that may come without your anticipation. Right? So yes, we have these elements of a birth plan. You have them executed, well written, well documented, well relayed to whoever needs to hear them. But then when they do not go in line with your plan, be ready for any emergencies. For example, maybe you were planning for natural birth through the medical route in a hospital, and then they discover that there's a complication and you are being prepped for an emergency C-section. Please never be rigid, right? Be always malleable, ductile, and be ready to be flexible for whatever situation. When they say that, oh, complication, emergency C-section, be ready, right? So plan, but then have it may happen in mind, right? And be ready to tackle it, be ready to cross the bridge when you get to it. Okay, so now let's talk about movement and wellness, right? Okay, there is this thing called prenatal yoga. I am always for yoga. Oh, yoga, guys, whether you are alive and well, yoga. Pregnant, yoga. Labor, yoga. After delivery, yoga. Stressed, yoga. Those who know me know that I'm a yoga baby. Right, I always recommend yoga. But then today, since we're talking about labor and delivery and planning for birth, we're talking about prenatal yoga. What is prenatal yoga? It's just the movement. Maybe you can use a yoga ball, to move your hips side to side, or whatever movements you feel in line with yoga stretches, whatever you use. I have PDFs for all of these things I'm talking about. And if you have questions, don't worry, contact me. My WhatsApp number is always there in every post. Go to my wall or my profile, you will see my number. So if you have any questions in line with what I talk about, or you want to vent, or you want anything, or you want to connect or anything, check my number. It's in my profile, right? So there are yoga stretches. These yoga stretches and exercises, they relax the pelvic muscles, right? So that the pelvis can be loose enough and be open, ready for birth. Okay. And also it improves circulation, right? And we know the benefits of good circulation in your body. Okay. Another thing could be conscious breathing. Breathing consciously, not breathing because it's just a genetic occurrence, right? So breathing consciously tells the nervous system to calm down during labor and delivery. And then visualization. Visualize your birthing process, the whole process. And this helps the mind to adapt and cycle faster. Right? The mind cannot tell remember, I know that you know, but remember that the mind cannot tell the difference between reality and imagination. So when you are imagining a smooth birth process, the room you are in, the exam, hey Diana, don't have baby fever. Don't. Don't have baby fever. Hey, this thing is, yeah. Hi, Titizile. Where was I? Oh, I was talking about visualization. Yes. So when you're visualizing the environment you'll be in, the smooth birth process and everything going well, going according to plan, your mind cannot tell the difference. So it will adapt quicker, right? The birthing process, the actual birthing process will be easier because you've already manifested it. It's what they call manifestation. But today we're not talking about quantum woo-woo, right? So, but I know it's true. Visualization helps the mind adapt faster to whatever you want to be. Okay? It's truth. It's truth. It's truth. It's not quantum woo. And then walking. Walk, right? Pacing brings a sense of grounding. When you walk about, you just feel grounded, you feel in control of your body. So yes, it's walking. So let's recap. Movements and wellness. Number 1, it's prenatal yoga, conscious breathing, visualization, and walking. Right. So all those are movements and wellness in line with birth. So what can you expect? Now we're talking reality. We've spoken about all of these plannings and theories, but now let's talk about reality. So what to expect? Right. We live in a world whereby the medicated route, the hospital route, the Western kind of route has been normalized. We just know that, oh, you're pregnant, you should go the hospital route. Yeah, that's the normal route. In fact, you are shunned upon if you don't take the hospital route. That's how normalized it's become. Right. So in this route, I'm not here to trigger this route, but however, in this route, you are told what is expected of you instead of you telling the people who are assisting you what you are expecting of them. This is shutting down and minimizing, eliminating the woman's voice. Yes, yet the woman is the starring of the show in this case. So that's why I'm like, this thing has truly eliminated the woman's voice, and we should reclaim it back. But then today I'm not about that. That's a Monday session thing. Right? Deconstructing is a Monday session thing. And if you're interested in me taking my Viva womanhood or Viva humanity route, join me on Monday 1 p.m. South African Standard Time. Every Monday 1 p.m. we deconstruct, we question everything, even these things that are considered taboo to be questioned. We question them on Monday 1 p.m. So please join me then. But then no, today I'm just here to talk about this whole thing. So pre-labor, what to expect, right? You may expect Braxton Hicks. What are Braxton Hicks? It's false labor, considered false labor. You feel like you're going into labor, but it's just an exercise, right? Sometimes it happens weeks or even months before the actual labor and delivery. So expect that. Don't get alarmed whenever you feel like, Aibo, the baby is coming, but it's not yet due. Am I having a premature baby? And then you get to the hospital, they tell you that, no, don't worry, it's false labor, right? It's called false labor. It's Braxton Hicks. It's just nature or the universe or God helping you practice this whole yeah baba sukuma fast, right, kind of thing. Okay, so expect Braxton Hicks, right? And then expect also the real labor, right? There is what you call contractions. Yes. Okay. Pre-labor, what happens in pre-labor? The cervix softens and thins down, right? The contractions are still not that much, right? But then the cervix, it thins and contracts, right? And softens again. And also you may experience back pain, right? You're not in labor yet. You're not in labor yet. Right now I'm still talking about maybe a day before labor, weeks before labor, or immediately after the Braxton Hicks or during the Braxton Hicks, right? Because this whole disaster starts after the Braxton Hicks. Once you start receiving Braxton Hicks, just know that, oh, it's over for you. And I feel like this is the way the universe is actually preparing you. If you're not yet prepared, you're not yet having the hospital bag, and you hadn't had plans in place for your labor and delivery, this is when you should start planning for real now, because it means that it's really close, right? So after Braxton Hicks, then you experience these things. Your cervix softens, right, and thins. You have back pains, even if you had back pains throughout your pregnancy, but now they get really severe, and yeah, you can feel that no, something is happening, right? Those are the back pains. And the baby drops. It's called lightning. The baby drops down. You just feel it that, man, I'm carrying low now, right? So the baby drops excessively. Oh no, it's about to rain. Oh, and I'm really counting on this electricity for my internet, but then I'll be quick. We're about to be done, right? And also you may experience nesting, like you just want to rest, you want to sleep in, right? Just know that you're about to be due. Yeah, you're close now, right? Sometimes you don't really want to sleep in or nest. Sometimes it's the opposite. You get hyperactive, right? Some people will feel like that. Yay! I did spring cleaning. I washed every blanket. That should be a sign that, oh, it's nine. It's nine. Right? Now let's talk about the actual labor now. Not Braxton Hicks, real labor now. Here you have real contractions. They may even, when they monitor you, they find that you are 6 centimeters dilated. And also, there's another thing I want to say, that sometimes you may be 6 centimeter dilated. We all know, most mothers know, and healthcare practitioners, we know that you start pushing at 10 centimeters, right? But sometimes you may be dilated 6 centimeters and you feel the urge to push, right? So that's why I'm saying that labor and delivery here, the mother should be the star of the show. Know that, hey guys, I feel like pushing, right? These people should be assisting you, not telling you what to do, because this is your body. This is what happens. Your body is the one that is communicating. Listen to it and tell them what your body is saying. So the mother should be the star of the show here, because I, for one, I was dilated 6 centimeters, but I felt the urge to push, and I told them that, hey, I feel like pushing. Imagine, I had never experienced this thing before, but I felt that if I hold this thing any longer, I may even burst. So I told them that, no, I feel like pushing. They were like, you're 6 centimeters dilated, but then I said, but no, I can feel it. Then they said, okay, kibel, right? And then I pushed, the baby came out, I was ready. So listen to your body. I always advise this, listen to your body. So yes, regular contractions, you are 6 centimeters dilated. That is called contractions. Then there's this thing called active labor now, whereby you are 10 centimeters dilated. It's time for you to push. Sometimes Sometimes you may think that you're having contractions, you're just only 6 centimeters, yet you're already in active labor at 6 centimeters. Just what I've been talking about here, right? So listen to your body. These people, the healthcare providers, they're here to assist you. So yes, lean on their support, but lean on it while listening to your own body, right? They are not the one experiencing this thing. You're the one who's experiencing this firsthand. They are only second-hand experiencers, and they are listening to you for guidance, right? They want you to be the leader. Lead them, right? So that's how this thing works. And then each wave brings the baby closer and prepares the mom for pushing. Contractions are not your enemy. Contractions are not here to punish you. This pain of contraction, it is not a curse. It's a signal. This communication is telling you that, okay, push. Okay, stop. Now, if you're stopping, I'm going to push. It's time for the baby to push, right? It's a way. It's just that we're disconnected from our bodies. We're disconnected from understanding biology in the quantum realm, right? We just think that, no, listen. Okay, not this ear, not the physical ear, but listen. Know what your body is telling you, right? So yes, whenever you're contracting, when the contractions are happening, like, right? You can literally feel the baby pushing. It's a communication, the one I was talking about at the beginning. That is, there's a communication, there's electromagnetic synchronization between mother and child. You are communicating at a quantum level, at an energetic level with your child. So when your body goes, the baby pushes forth. When your baby stops going like this, it means that your baby is not pushing forth. Also take a breather, wait, don't push, right? So that's how it goes. This thing it's a biological, your body is a biological machine, man. Trust it. Trust it. Now we're talking about the delivery itself. I have some few tips here. I didn't know them until I also researched them. For me, it was just a revelation, or let me call it a game of luck, right? I was just going through an article and I found it. I was going to make the same blunder if I haven't found it. I haven't found this article. It said, push like you are pooping, like you're taking out your shit. Right? And I was like, oh, that's how you push? I would have pushed like pushing a baby out of the vaginal canal. That's how I thought the pushing was. And then when I got there, I started pushing out like I'm pushing out poop, like I'm pooping in the loo. The baby comes out easier with zero tearings. Zero tearings, right? There was no tearing, right? So push like you are pooping. Don't push like you are peeing. Remove the mental processing of that. You know what? The baby is coming out of the vaginal canal. Remove that. Just think of I'm taking a shit, and the baby will come out with zero tearings. Obviously, depending on the baby size and other factors, medical factors. Maybe there will be tearings, but I assure you, there'll be minimal tearings if you follow. You're welcome, Diana. If you follow this pushing route, don't push like no. Remove that mentality of vaginal birth. Imagine as if you're taking a poop, that the baby's poop, right? It helps a lot. And then also skin to skin contact is very important. I had mentioned it at the beginning of this live as to why it's important. Also, if you missed this live, you came late, or you just missed it, or you can't listen to it right now, don't worry, it will be saved on YouTube. My YouTube link is in my profile. Where was I? Yes, delayed cord clamping. Yes. But in most hospitals, now they delay the cord clamping. They don't cut it immediately after the baby comes out. They also understand that there should be this placental transfusion. They understand. However, if you're doing a home birth and you're with your doula, maybe your doula is cutting it earlier than you anticipated, it's okay. Communicate with them. Even at the hospital, if you feel like, no man, they've cut it earlier, communicate with them. However, we live in a hi Pulanala, woo, Pulana, please, 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 please renew your beam. Why is your beam gray? Woo, Pulana, la. So yes, you can come. However, as I've said, that as women, we have to reclaim our voices back, because truth be told, in this day and age, the medical way of birth is the normalized way of birth. But then you cannot tell a healthcare provider that, you know what, I feel like you are clamping the cord earlier, I want to wait a bit. Woo! They can tell you your stories. Child, no, who do you think you are? There are a lot of people here in line waiting to deliver. Now you think you're the healthcare practitioner. Right, especially when you've gone through the government route, right? Maybe it's better in the private route. Maybe they would listen to you, but then in the government route, my darling, I don't know. We have a lot of awareness to do and talk to these healthcare providers that, guys, the woman is the starring of the film. The woman, the one who is giving birth. But then, slowly but surely, we'll raise awareness. We will raise awareness in line with this. However, knowing about it will give you enough empowerment to try it, right? Oh, please, wait a bit. I feel like there's still blood in the placenta. Can we wait a bit until the baby gets the maximum amount of blood so that we can prevent anemia? Right? Just, yeah, be your own advocate. Be your own advocate. And then after delivery, today we're not going to talk deeply about the C-section and the natural birth. There will be a session. There'll be a session talking deeply about that. Also, please make sure that you check my stories every day. I post a lineup. We'll see, this week we're going to talk about this. This week we're going to talk about this. Blah, 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 blah. So, yeah, be on the lookout on my stories. I post every day. We'll talk about what to expect during natural, what to expect during C-section and all of those things. Today we're not there. I will just go haba. But then post-delivery, when you did the natural birth giving, don't rush to raise your head. What maybe mostly will happen after they take the baby out, they put it on your skin, on your chest, or whatever, or wherever they put it. After some time, they clamp the cord, right? And after they clamp the cord, they give you guys an injection, especially if you're in the Western medical route, right? They give you guys an injection. When they're done, after a few minutes, they take the baby away for weighing, leaving you on the bed. You may be tempted or too excited to just, I can't wait to meet my baby, right? And you may raise your head or your upper body. Don't rush. After they've taken the baby away, breathe. Your body will tell you to then raise your upper body, because you may then collapse due to dizziness. You've lost so much blood and your blood has been concentrated in your sacral chakra. You don't have a lot of blood in your head space. So when you raise your head, you are eliminating so much blood downwards. There's already no blood and you're already draining it downwards. So you may collapse due to dizziness. So wait a bit. You will feel it. Once the blood goes back to your head, you will feel it. You'll then be ready to wake up. Don't get excited. Don't let excitement get the better part of you, such that you risk your own health because of excitement, right? Know when to balance these things off. So yeah, don't rush to raise your head. That's just a tip I have. It's something I learned myself from experience. Don't raise too fast. And also expect uterine contractions. It's very painful. It's a very painful thing. Like, I see the mhelo is clearing past, right? It feels like you're going into labor once again for weeks. For weeks on end, it's still contracting. The uterus is going back to its normal size. It's called, hey, what is it called? I have forgotten the name in vernac, but in English it's called uterine contractions. The contraction is the uterus is trying to go back to its original size. And boy, oh boy, isn't it painful? Where it's so painful, you are literally in labor for a full week plus. Where expect that, please. Do not be discouraged by this, but it's painful. It's extremely painful, and do expect it. Also, I always say this in all of my videos, that the motherhood journey is full of emotions. Sometimes contradicting emotions, but then validate them. There is no emotion that is, something's wrong with me. It doesn't exist. It's all in the head. No, no, no. Validate all your emotions, even if they are contracting. They are contradicting. Gosh, it's the uterus I'm talking about. It's taking me off my train of thought. But then, even if your emotions are contradicting, validate them, because they are very much valid. In this point, you may feel euphoria, but at the same time feel exhaustion. I'm exhausted, but I'm excited. I don't know how to handle both these emotions at the same time. I don't know how to entertain these emotions at the same time. It's fine. Do attend to the emotion that feels more superior to you. Prioritize it, right? The more prioritized emotion, take that on. Right? And don't say that it's all in the head. No, no, no. Awuhlanyi is not all in the head. Or you are just going through a roller coaster of emotions. There's a lot going on. Motherhood journey is just this journey, like, truth be told, it's I personally call it lunacracy, right? Motherhood is just being an endless lunatic. Once you're a mom, just accept that you are going to be a lunatic for the rest of your life, my darling. So so it's okay. It's okay. Validate your emotions, even though they are contradicting, even though they don't make sense, right? So the post-delivery hours. These hours set the tone for recovery and attachment. And it's when you are starting synchronicity with your child. And boy, oh boy, I can't emphasize this enough. I always say this. There is this connection between mother and child. In as much as you were physically connected before birth through the umbilical cord, that was cut. There is this spiritual Bluetooth that can never be cut or clamped. It is called the silver lining. As I am saying, that once you are a mom, you are connected to this child for eternity. You're going to be a lunatic for life. So after birth, synchronicity begins, and you and the child will be like this for the rest of your life. Welcome to the journey of lunaticity. Whatever you choose to call it, right? So yes, once again, I have a room whereby you can come and vent. It's just a group of moms every day from 10 a.m. to 11 a.m. It's just a group of moms whereby you just vent, you just sit here, be heard, we meditate together, and all that, right? There is a room for that. And also I take on one-on-one sessions. If you're interested, my number is also on every post. I'm just here for motherhood. Yes, you're a lunatic, welcome, fine and well, we understand you here. So yes, if you're interested, just contact me. And also there is a book and a diary. It goes hand in hand with what we talk about here, right? So now let's summarize the hell out of this session, baby. Okay, so today we were on week 6 talking about preparing for birth, plans and preferences. The session summary reads, this week focuses on empowering you to make informed, intuitive choices about your birth experience. From birth plans to preferred environments, pain managements, options to emotional support, this is your invitation to explore what safety, sovereignty, and softness looks like for you. Preparation is not control, it's clarity, right? And then excerpt from Born into Change, which is the book that goes in line with this diary I'm reading from. The gist from this excerpt reads, the birth you envisioned is a reflection of the power you claim. Woo! And the chapter is chapter 6, Motherhood and Legacy 1.2, Labor and Delivery. It reads, labor is not just a physical event. It's a spiritual threshold. It's the moment a woman crosses from carrying a life to releasing it. No matter how it unfolds, natural, medicated, surgical, it's a rite of passage. The body opens, the mind surrenders, and the soul expands. Labor is not about control, it's about trust. It's not about performance, it's about presence. Ooh, baby. And what is the code for today? Our code reads, you are allowed to choose how you shit. Let's repeat the code. I was receiving a call. I hope it didn't ruin anything. The code for today reads, you are allowed to choose how you bring life into the world. Your voice matters. That's our code for today. I just had to repeat it because I was receiving a call on TikTok. Yet on TikTok is where I make my posts in line with the summaries. However, mommy, I always say this, and today I'm going to emphasize this, and I will emphasize it in every week and in every session. Yes, I may come here and give you these tips and give you this information. However, everything is up to you. I'm not saying take whatever I'm saying as religion, right? I'm saying that take the information, understand it, and then draft your own beliefs, draft your own feelings and your own wants and needs in line with the information I've given you, right? Never follow somebody, right? Take whatever they present to you as information, as data, to then create what aligns directly with you. I am a scientist by profession, but then I always say that science is not 100% facts. It's just only a study, and a study that was just done to a group of people which may not 100% resonate with your own biological makeup or your own quantum field. So yes, take science, but then don't take it as religion. Understand your own body, trust your own body, and believe in your own body. You were made to feel instinctively in the quantum realm. Deep spiritual things. Trust that. Believe in your intuition, believe in your instinct. That's your biological tracker. Mwah! Bye everybody. See you next week, same time, same place. Every Friday, 1 p.m. South African Standard Time, we talk. You got this, dearest mommy. Every Monday, 1 p.m. South African Standard Time, we talk deconstruction. So meet you there. See you guys next time. Bye. If you missed this, please find it on YouTube. Can't wait to have a baby. Sorry, I can't see the whole thing. I loved this session. Oh, thank you, Diana. Facebook, sorry for shifting you guys. Bye, guys. Bye, everybody. See you next time. Today, the session, I started at 12 because the weather is not doing good outside. So I was afraid that electricity may do shenanigans on me. So, yeah, I was afraid. But then, yeah, if you came late and you were interested to learn or get information from the beginning to end, you'll find this video on Facebook. It will be saved. You'll find this video. It will be saved on YouTube. The link is in my profile. It's in my bio. Everywhere. Instagram, TikTok, and Facebook. Guys, mwah. Bye. See you next week, Friday, 1 p.m. South African Standard Time. Bye, TikTok.